Hi, good evening. Doc Rojo here again. And yesterday I spoke a little bit about type 2 diabetes. And today I wanted to talk a little bit more about individualizing type 2 diabetes goals, as well as getting a sense for what are some of the complications that sometimes come along with type 2 diabetes. Now, everybody has a slightly different sense of where those type 2 diabetes goals are. If you look at the American Diabetes Guidelines, the Endocrinology Society Guidelines, they're pretty clear-cut across the board as far as where somebody's goals should be when they've already been diagnosed with type 2 diabetes. If you listen to Dr. McDougall, who's the author of the Starch Solution, his goals are a little bit looser than the others. So why do we care about goals with the diabetes anyway? What is it we're trying to do or trying to prevent with it? So basically, the main problems with type 2 diabetes are that it can very much shorten life expectancy, especially if it's diagnosed before age 40. When somebody is diagnosed with type 2 diabetes before age 40, according to one of the conferences I went to, the average life expectancy is on average 20 years shorter than what would be expected, mostly because the diabetes tends to be stronger and more difficult to control. Now, mind you, most people are not using the dietary methods as an adjunct that I mentioned to help control the diabetes yet. Hopefully that will change in the future as more people start to learn about these methods, especially because they work so deeply into the system. So I've got a couple little infographics here. So you might have heard type 2 diabetes. What are the main things it has problems with? It's the leading cause of blindness, leading cause of kidney failure, and leading cause of amputation. Basically, with the blindness, the small blood vessels in the back of the eye become damaged from the diabetes, and people can bleed in their eye. They can have other lesions and other eye problems. Cataracts are more common with people with diabetes. And so that's one of the reasons why keeping an eye on the eyes is exquisitely important. So please, if you have type 2 diabetes, or type 1 for that matter, the complications are actually the same for both type 1 and type 2. Please make sure you see an eye doctor about once a year, maybe every other year, depending on what program you're following and who you're talking to. Kidney disease. Now, type 2 diabetes is very much associated with kidney failure. In fact, as a resident, I spent 2 months on the kidney wards in Albany Medical Center, and I will tell you, having your kidneys fail and being on dialysis is absolutely miserable. And the people that I saw getting kidney transplants and going on dialysis and all of that, by and large, were the folks whose diabetes had been poorly controlled over that course of their time since they had been diagnosed with it. And then finally, amputation. So this is another part of the diabetes complications which gives people the most misery, because imagine over time having to lose a toe, 2 toes, a foot, entire leg up to the knee. And so this is one of those reasons why good diabetes control tends to be helpful for preventing some of the complications of this. Now, this actually ties into a few other complications of diabetes. So when those little sugar cells or sugars are basically glommed onto the red blood cells, I like to think of them as being kind of like a naughty little kid in a store, a little BB gun kind of going pew, 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 pew. So basically it's damaging the blood vessels. And it's such a tiny, tiny marker or a tiny level that we don't even notice that it's happening. But it damages the blood vessels in the heart, it damages the blood vessels leading to the tiny nerves in the feet and to other places inside the body. And so when those nerves are killed off in the feet, that's when it becomes a little bit dangerous. So it's very important for folks with diabetes to also learn how to do foot checks and to get a sense for whether their feet are affected by numbness. Because if you can imagine, if there's a small infection or if you step on a nail or something and you can't really feel it, well, then the infection gets worse and it sets in. Also, the blood supply that goes down to that leg, the little blood vessels that are going down here in the leg and heading to the feet also get clogged up. In fact, venous insufficiency, we call it, is one of the other main comorbidities of people with long-standing diabetes. Another thing that is a marker for the diabetes that doesn't happen in everybody, but happens often enough that I'll mention it here, is sometimes the hair on the shins actually starts to go away because of the poor circulation going to that area. And so sometimes I'll joke if a guy, hey, have you shaved your legs? And they'll be like, no, I didn't even notice it was disappearing. And then I'll point it out and they'll say, oh yeah, that's been kind of going away over time. So sometimes the leg hair actually can go away as well as a result of the diabetes. So those nerves that get damaged, well, it's very noticeable when you've got numbness in the bottom of your foot, and that's also, again, why foot exams are very important to take care of the feet, watch out for fungal infections, etc. But the nerves in other parts of the body, namely the chest area, also are impacted, and this is one of the ways in which diabetes can lead to an early death. For example, if the nerves in the chest are not working as well as usual, a diabetic could be having a heart attack, but because the nerves don't work as well as they used to, essentially it could be a silent heart attack where they don't really realize that they've had it. This is one of the reasons why a lot of my patients over age 40, especially if they're male or a woman over 50 or having gone through menopause with type 2 diabetes, not universally, but very, very often I will have them go on a treadmill and basically do a stress test, because having type 2 diabetes is essentially equivalent to the same risk of having a heart attack as somebody who's already had a heart attack. And so, again, these are all very important reasons why it's so important to prevent the disease from happening in the first place whenever possible, but also when somebody has it, in order to maintain health longevity, to basically do as much as we can to reverse it from the roots out. Now, the medications and other lifestyle measures that can be used to help control the type 2 diabetes, they will help to some degree. For example, people might also use statin medications or other exercise in addition to a very healthy diet in order to minimize the risk for things such as heart disease. The beautiful thing about using a whole food, low-fat, plant-based diet with no added oils is that it's the only diet that I know of, and the only treatment program that I know of, that actually opens the blood vessels to the heart once again, which is essentially otherwise unheard of in medicine. Most everything else is kind of propping things up, hold things open with a stent or try to blast it with a statin medication. And in some cases, of course, those things are absolutely appropriate and needed, but I tend to like to get to the root of things, and for those who are willing to join me in that, it is a beautiful method, because not only does it take care of heart disease, but it also has a tendency to make the diabetes go away for the most part itself. Next, speaking of those blood vessels that are having trouble working, the next complication is called gastroparesis. Now, that's a fancy Latin word, really two words mushed together. Gastro means stomach, and paresis means paralysis. So in other words, sometimes people start to get this feeling of burping and bubbling and feeling as though they get very full very easily, because normally the stomach squeezes and churns and basically forces the food to mix up and then empty. And when the nerves that go to the stomach get a little bit paralyzed because of the diabetes, then instead of giving a nice squeeze and churn and all that to mix the food up and move it on out, the stomach wall goes, it just kind of doesn't squeeze like it's supposed to squeeze in order to get things out. Some tips if somebody is suffering from gastroparesis is basically having food that is very easy to digest and that can be blended. For some people, green smoothies and other soups and things that can go very nicely into a blender. Sometimes it's very, very helpful to get food through the stomach, because soups and things that are blended really don't need to be churned all that much. They're okay with being kind of going through the system without that. So the way to diagnose that is by doing a nuclear emptying scan if you suspect that you have gastroparesis. Again, as with everything we're talking about in these videos, I cannot diagnose anything over the computer, so please, it's imperative to talk to your own personal physicians about these matters. Finally, the other things that can happen with the type 2 diabetes is pneumonia. So just as people with diabetes tend to get more foot infections, fungal infections of various sorts in the skin folds on the feet and other places, small bacteria love to basically go in there and get and make people get sick with pneumonia. And so that's one of the reasons why anybody with diabetes, type 1 or type 2, should get a pneumonia vaccine. And again, please talk to your physician about that. Also, one more organ that really gets impacted by diabetes, pretty much every organ does, but it also is one of the leading causes of, fatty liver. I forgot to write these cards out so that they could be seen easily online. So basically, the process by which the sugars get deposited when the metabolism goes out and the metabolic syndrome, prediabetes and diabetes, all of those things tend to lead to fatty deposits in the liver. And if somebody gets a fatty liver, they don't necessarily know it for maybe 5, 10, 15 years. Sometimes you'll see those liver enzymes kind of slowly creep up, and sometimes they won't creep up very much, but you might see it incidentally on a CT scan or an ultrasound. Well, why would you care about fatty liver? Well, the trouble is if the liver gets too much fat for too long, then sometimes it can scar down and cause cirrhosis, and sometimes it also can lead towards cirrhosis of the liver or liver failure. So we've covered a few organs that can very much be impacted by diabetes and some things to keep in mind for that. So I talked a lot about some of the scary things that can happen with type 2 diabetes. Generally speaking, the lower the A1C tends to be, the less likely it is for any of these disease complications to happen or to impact somebody. And so basically, not to go out and get depressed or feeling down about all these things, but to say, oh wow, this is important, and these are many reasons why, keeping the diabetes at a good number is vitally important for health and longevity, and not just for longevity, but surviving into that old age with a healthy body, a healthy mind, and a good spirit. So if somebody is not yet diabetic and they're just beginning to want to prevent diabetes, as I mentioned in my last video, the goal for them is, I really like to see the A1C somewhere between 4.5 to 5, because in my experience, whenever the A1C gets over 5, it has a tendency to keep on going. Now that's not true universally, and there's a few other things that can impact this A1C number that is kind of beyond the scope of these quick, brief presentations. But generally speaking, if you're fresh and healthy, 4.5 to 5 is absolutely perfect, and probably if you're at that point, you probably don't even need to be watching your sugars or watching your A1C. If somebody is managing their type 2 diabetes with medications, and the legs of the triangle for managing diabetes, medications are kind of the mainstay of what people are doing. Dietary modification, this is where people get trained on carb counting and the like from our austere nutritional programs, and then of course exercise. Changing any one of these three things will change that A1C. And so if somebody is relying in part or solely on medications and doing some things to help with their diet and some things to help with their exercise, well, the goal A1C is definitely less than 7. Anything over 7 we consider to be poorly controlled in terms of diabetes. And really, depending on where someone is in life, usually like to see it between 6 and 6.5. Now, when somebody goes through some of these dietary interventions or has a gastric bypass surgery or another major intervention in their life in order to reverse the diabetes all the way. And I would argue that the plant-based lifestyle that I mentioned before is one of the most elegant and fastest ways of really cleaning out the works and getting rid of it. The goals, in my case, or what I talk to people about, the goals are a little bit different because you're getting it out from the roots and we're not worried about dropping the sugars too low. If somebody is doing a mixture of plant-based and medications and they're not very careful, especially in the very early stages, sometimes the sugars can drop too much in the beginning, or they have to be extra careful because the medications have a tendency to force that sugar down. And one of the early reasons why people should keep a close eye on their sugars, especially when they adopt this lifestyle, is because of this forcing property with medications. Generally speaking, when somebody has become established on a plant-based lifestyle, the need for these medications has a tendency to just kind of fall away. And the remaining pancreas that is left is able to keep up with the demand of the body for the insulin, because when the receptors are unclogged, the insulin works. It works much more efficiently, it works much better than it did prior to engaging in that lifestyle intervention. So the goal for somebody when they are doing that intervention, I would say it's very safe to allow that A1C to go back to almost pre-diabetes levels, and actually maybe back towards original diabetes, original levels when they were healthier. So maybe somewhere between 5 and 5.7 or 5 and 6 or so. Again, the lower the A1C in general, the less likely the so-called scary complications, which are very real, unfortunately, do have a tendency not to occur as frequently at those lower A1C numbers. And last but not least, if somebody is towards the end of life and they say maybe life expectancy is less than 10 years, or if they're having a great deal of trouble with getting their A1C down below 7, then somewhere around 8 or so may be an acceptable level. So the idea is that if somebody's on their deathbed, you don't necessarily worry as much about tight control of the sugars. However, nobody is entirely psychic. We don't know exactly when somebody is going to pass away from one thing or the other, by and large, very often. And so I would suggest that maintaining quality of life into older age is also a very good goal of diabetes care. Alrighty, so I think that was the main things that I want to talk about on here. A couple last little pointers. When we talk about diet, medications, and lifestyle, a lot of times people have been told that they should use aspartame or artificial sweeteners instead of sugar. And the trouble with the aspartame is it tends to also be troublesome to the metabolism. And so I generally do not recommend that. There is a safer thing. Erythritol is the healthiest. Actual dates and actual whole fruits can be very healthy sources of sweetness. Also, Truvia in small amounts could be okay as well. That's stevia, either in whole plant or in extract form. Also, avoiding alcohol can be very helpful as well for diabetics. The main reason is because when somebody starts getting that fatty liver disease, and just based on the way in which diabetes progresses, almost everybody that's got diabetes has some degree of fatty liver deposits. That's type 2 diabetes. And so the idea for that is to, 1, reduce or avoid alcohol, and 2, making sure that you have a hepatitis B vaccination. And I used to wonder, why on earth would we care about a hepatitis B vaccination? Well, it turns out that because of the propensity for diabetes to cause kidney disease, basically, if there's a chance that somebody is going to end up lying in a dialysis bed, with your arm outstretched and your blood going out and through a machine and getting recycled back into your body. Well, you're not the only person that's using that dialysis machine. There's other people that also need to get their blood artificially cleansed, and some of those people may have hepatitis, and so hepatitis B vaccination is important for that reason. It's a 3-shot series, and again, if you have any concerns, please talk to your primary care doctor about these as well. Alrighty, so that looks like everything I want to cover for this addendum to the presentation that was done yesterday. I'll have a few more words about type 1 diabetes coming up in another presentation. Thank you for watching. Hope you enjoyed, and hope it was helpful for you. Bye-bye.